What if the world forgot to feed you? Not because it meant to, not because you were invisible, but simply because you were too far away. This is not fiction. This is a quiet reality between tens of thousands of nomadic families across Mongolia, and it separates them from something very essential: health. I'm here to share one powerful idea with you today. No one should be nutritionally behind, no matter how far they live. Imagine your body as a campfire. It burns the brightest when fed with the right fuel, like proteins, vitamins, and minerals. But in the Mongolian steppe, many families only have access to dairy products and meat. According to the National Nutrition Survey, nearly 48% of their daily diet comes from dairy products, 30% from meat and other animal products. Fruits and vegetables? Less than 10%. A 2022 UNICEF report found that more than 1 in 5 children in rural Mongolia suffer from micronutrient deficiencies, like iron and vitamin A, which is essential for brain development, learning, and immunity. These aren't rare cases. These are slow-burning, silent health emergencies. But here's the twist. This isn't about poverty alone. It's about proximity. You can have animals, you can have a home, but no access to diverse foods, no clinics nearby, and no nutrition education. And over time, the fire weakens till it eventually fades away. Mongolia is home to almost 30% of its population living as nomads, moving with the seasons far from urban centers. But barriers like distance, harsh weather, and limited infrastructure keep many from accessing even the most basic healthcare. In winter, temperatures can drop to negative 40 Celsius, cutting off entire families from markets and clinics. In summertime, long distances make fresh produce nearly impossible to reach before it spoils. Traditions sustain their way of life, but lack of nutritional diversity weakens their future. Let me ask you a question. If survival itself requires us to keep moving, how do we get health to move forward too? Let me give you an idea. A mother wakes up before dawn in the steppes. She milks her cows, prepares tea and dairy for her children. They eat, they pack, they ride for miles. The wind is biting, the land is endless. Her son's curious, hungry to learn, but he's constantly tired. Not from work, but from his body lacking iron. His mother wonders why, even though she feeds him every day. The barrier here isn't love. It isn't effort. It's distance. It's the gap between what her family has and what her family needs. And this is the barrier that we can break. Let me ask you a question. What if we decided that no one was too far to matter? What if every policy, every program, every plan asked first, does this break barriers for the people at the margins? We talk about breaking barriers in technology, in communication, in education, but the barriers of health, the barriers of geography, of distance, remains one of the most stubborn ones. We talk about if we can connect continents with fiber optic cables, then surely we can break the barriers that stop a child from accessing even the most basic healthcare. But there is hope. Organizations like UNICEF and local NGOs are working hand in hand with nomadic families to solve these issues directly. Fortified flour and vitamin supplements are already addressing hidden hunger. Simple innovations like the Lucky Iron Fish are already increased iron intake. Seasonal mobile clinics are bringing doctors, nurses, and essential supplies closer to the families. And nutrition education programs are helping families to get the most from what they already have. These solutions prove something powerful. Even in the vast, harsh steppes, distance does not have to mean deprivation. So let's stop assuming that living remotely means living without. Let's stop designing futures that only work in cities. Let's stop mistaking silence for safety or distance for invisibility. Because the child who eats one more nutritious meal today, the mother who gains an extra week of energy, the family who feels just a little more seen, they aren't the exception. They are the future. And they deserve to be part of the story we're writing. And if we're serious about breaking barriers, then we should start with the ones that matter the most. The barriers of geography, of distance, of health, of nutrition. No one should be left nutritiously behind, no matter how far they live. Thank you.